I like the question, and I think it's an important question. It's also a very challenging one to answer. I'd highlight that the study wasn't designed to specifically address that question. We didn't collect protected health information, and as such, we've got limited details on important things like socioeconomic factors that might have affected care delivery, for example, insurance coverage, income of patients, job status or location, access to transport or living conditions, and these can all affect healthcare utilisation or risk of COVID infection. As to why the Hispanic patients were more likely to experience a decline in overall visits, I'm speculating that perhaps language barriers have played a role in efforts to reschedule or delay appointments or treatment. And while the reasons for these disparities weren't captured in our data set, we do know that at least access to digital infrastructure would have been hopefully equitable in two societies such as New York and Boston. But that doesn't mean that the people accessing that technology had equal levels of health literacy or access. There is some data suggesting that health literacy is less prevalent in some minority populations, and they're less likely to utilise online patient resources. Perhaps that might explain some of the difference. So whereas we don't have direct data on this, I mean, it's clearly an area that we need to do more research into to look into some of those additional factors that might be at play and define why minorities are affected.